Right, Brittany. Well, they wanted to know if you got vaccinated and then got sick, would you have more immunity than if you got sick first and then got vaccinated? Turns out it's about the same, and it does a pretty good job of giving you that super immunity. Researchers at Oregon Health and Sciences University gathered the blood of 104 employees from OHSU. All had received 2 doses of the Pfizer vaccine. They were able to study antibodies in the blood of the volunteers and watch how the antibodies did against 3 COVID virus variants before the Omicron variant began to spread. Their earlier report out in December showed a finding you may have heard about. Having both shots of the mRNA vaccine or just one of Johnson & Johnson, then getting COVID gave super immunity. But it was still unclear whether it would work the other way around. Would getting sick first, then later getting vaccinated, still provide super immunity? The answer is yes. Here's Dr. Marcel Curlin, one of the study leaders.
So it's pretty important, I would say, because it speaks to, number one, the reason to get vaccinated. And it also speaks a little bit to what the future of the pandemic looks like.
Dr. Bill Messer said the results show the body's defense system is adaptable and learns to recognize trouble and builds weapons against it.
We found that the antibodies in your blood following the combination were about 10 times more potent than the antibodies in your blood if you just have a vaccination.
The OHSU researchers did not study exactly how much immunity is achieved by only getting sick, but they say other researchers have found that immunity is wildly variable and that most people are left with mild immunity and can get sick a second time with COVID. Both researchers agree that the combination of getting COVID and being vaccinated will help eventually push the virus from being a raging pandemic to a yearly annoyance. And here's a hopeful thought. They believe the change is already underway.
We're seeing in real time this process of a transition to a milder form of the disease. So as Dr. Messer was pointing out, more and more people are getting immune responses, and eventually Omicron or whatever the next variant is, COVID, will encounter a more resistant population. And so we're seeing in real time, hopefully, a transition to more endemic, milder disease.
In the meantime, there is still a lot of virus and variant out there. In fact, the public health officer for Multnomah County, Dr. Jennifer Vine, said today that the county's disease trackers, listen to this, estimate that between the middle of December and the middle of February, half of Multnomah County's population will get the virus, or at least be attacked by it. That is a huge number. She's talking about 406,000 people. I've asked the county for clarification because, frankly, I find that hard to believe. That'd be 6,700 people a day, every day, for 60 days straight. We're still waiting to hear back from that. We'll let you know what they have to say. Back to you.